It's 12 o'clock. Thank you so much for joining us. We are in the Booster Beyond series, session 4, QI and QM learning series, the quality measures rating methodology and SNF QRP. We have Josh here today, going to go through the presentation, and I'm going to turn it over. Thanks.
Thanks, Melanie. So as we start with every session, want to just introduce us if you aren't already familiar. We are the IPRO QIN-QIO. IPRO is the contract holder for the quality improvement organization for 12 regions under CMS. IPRO organization themselves cover New York, New Jersey, and Ohio. And IPRO is also contracted with health-centric advisors in Clarent to cover Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont, and then Maryland, Delaware, and District of Columbia, respectively. So together, we're actually helping to support providers of around 20% of the Medicare fee-for-service beneficiaries across the country. So it's a great honor to help support you guys. If you don't already know who IPRO QIN-QIO is, you do now. So if you hear that word, if you hear the name IPRO, you know who we are. So with the boosters and beyond, we still want to keep a highlight on COVID-19 boosters. I know last week, U.S. regulators were actually talking about a plan for upcoming new booster shots coming out later in September or October. But we really want to make sure that you guys are prepared and continuing to push the boosters despite that. So, really urge all the staff and residents to get their boosters as soon as they're really eligible. Figure out ways that you can make it more accessible for your staff and residents, and including hosting a vaccine clinic. We actually have this amazing vaccine toolkit that I have linked here that you can prepare a community vaccine clinic for residents and staff and families. It's a really great toolkit. So if you haven't already seen it, really encourage you guys to take a look at that. And then continue to push the boosters. I'm sure we're all anticipating that we're probably going to have a surge later this fall. So fingers crossed everything goes good, but we want to continue to push those boosters as much as possible while we can. So today we're actually going to talk a bit about the quality measure component within the 5-star system, and then talk about how the quality measures are actually captured and reported. We're also going to go into a little bit about the different weights behind the quality measures and how the quality measure rating is actually calculated. It won't be exactly in that order, but we're going to make sure to get through everything. So the 5-star system, yeah. So today we are going over quality measures, which are based on information that's submitted within the MDS as well as claim-based data. We went through the health inspections rating 2 weeks ago. Last week, we went the staffing rating. And today, again, we're going through quality measures. And your 5-star is derived from these 3 components. So the quality measure rating itself is a combination of both your short stay measures and your long stay measures. So your short stay measures are measures that sort of really reflect the care and performance for residents who've stayed in the building for 100 days or less, and that are covered under the Medicare Part A skilled nursing facility benefit. And typically with these measures, the goal is really to improve their health status so that they can return to their previous setting, most likely or typically their home. And your long stay quality measures reflect the residents who have been in the building for 101 days or more. And typically with these measures, the typical goal is to maintain their highest possible well-being while residing in the facility long-term. Again, together, both your short stay and your long stay measures, while they're being measured separately, combine into your overall quality measure rating that contributes to your 5-star. And Melanie and Darlene, feel free to chime in at any time as well. And anyone else, if you have questions, hop off mute, put in chat. Let's make this a discussion. So with this slide here, I wanted to highlight some of the different weights that are assigned to your quality measures. So there are quality measures with a maximum score of 150 points each, which are your residents whose need for help with daily activities increasing, the percentage of residents who received an antipsychotic medication, percentage of residents whose ability to move independently worsening, hospitalizations per 1,000 resident days, and outpatient emergency department visits per 1,000 resident days. So those are the long stay measures for 150 points, and the short stay ones are the residents who improve their ability to move around on their own and rate of successful return to the community. Percentage of short stay residents who are rehospitalized after a nursing home admission, and then the short stay residents who've had an outpatient emergency department visit. Again, you can see, like I mentioned in the previous slide, where a lot of the short stay goals are focused on measures that are really trying to focus on ensuring that the resident can be safely discharged and get back to their level of care so that they can go back home. And those long stay measures are really focused on the residents and the impacts as they stay in the facility for indefinitely. And then you got the short stay measures with a maximum score of only 100 points. For long stay, you have the percentage of residents experiencing one or more falls with major injury, high risk residents with pressure ulcers, residents with a urinary tract infection, and percentage of resident who have or had a catheter inserted and left in their bladder. And then for short stay, the percentage of residents who received antipsychotic medication for the first time, as well as percentage of skilled nursing facility residents with pressure ulcers or pressure ulcer injuries that are new or worsened. So these all have, like I said, either a possible maximum of 150 points or 100 points. And these are the measures specifically that make up your quality measure rating towards your 5-star.
So Josh,
yep.
This is Darlene. So on that slide, you can see that not every measure that's in your CASPER report impacts on your 5-star. So like these are the ones that if you're trying to change your 5-star using the quality measures, these would be the ones that you have to focus on, right?
Absolutely. And it's not to say that the other measures aren't important, but if you actually want to understand what your quality measure rating is and why it is, as well as ultimately improving the quality measure rating itself, you need to hone in on the specific ones that are actually contributing towards that score.
But isn't this based on old data? Aren't your QMs based on old data? So like you can try to improve it now, but it won't show up for another 6 months?
So there's a quarterly refresh on the nursing home compare, and I actually have in my next slide some of the things that you can do now. So typically what's publicly reported, it's the past and information that's already been said and done for, but there's actually sort of a way to go about utilizing your live data to not only determine where you're currently going to be when it's publicly reported, but also provide direction on the things that you should be going for once, so that even though it's going to be publicly reported that you're at 20% antipsychotics, for example, you'll know ahead of time before it's even publicly reported that that's what it's going to be, and that you should start to work on it and develop a performance improvement project so that the following quarter after that you're going to see that improvement there. So thank you for chiming in. I appreciate it. Like I said, make this a conversation, you guys. This is your time. So how the measures are actually calculated is each of the measures themselves have, like I mentioned, maximum point of either 150 or 100. And depending on where your facility lands on each of these measures, you're going to get points allocated for that measure to create your totals. So I've provided you that table of your totals, say you have between 656 to 746 long stay for your quality measure, but maybe you have 763 between that and 1,150. So maybe you're a 4-star in your long stay, but a 5-star in your short stay. You can see that even though you're at different star ratings, there's the total threshold, so that you can understand where your total rating is depending on where you lie. And again, each of these measures, you're going to get either between 100 and between the lowest amount, I think for the measures that are 100 are, I think, 20 to 100, or as low as 15 in the 150 point quality measures. So as I mentioned, there's some quality measure strategies that you guys should keep in mind. So you guys have the ability to pull quarterly data or within your CMS key system and your CASPER report. So you should be tracking your quality measures at least monthly and noting which quality measures are below average and flagging for your building. And really, when I work with a lot of facilities and helping them improve their quality measures, really the first thing that you really should take into consideration is exploring your MDS coding accuracy, because a lot of these, as I mentioned, a lot of these measures are directly derived from what's being submitted into MDS. And there's a lot of nuances for these quality measures that if you are coding something incorrectly, you may be negatively impacting that quality measure. So always make sure that your coding's correct for your quality measures. And if it's not, then that there's additional training or guidance might be needed for your MDS staff. Because then if it's not a coding issue, you can address those poor outcome quality measures as true quality issues and incorporate them into your QAPI program and create performance improvement projects for flagging quality measures. So essentially, you don't want to start putting together this huge performance improvement project for X measure. If it happened to be a coding issue, then it was it's just a simple mistake as that, and you might not necessarily have a true quality issue that you're starting to do all this work on. So always start with your coding accuracy, making sure that everything's correct, and once you find that it's either correct or incorrect, adjust accordingly. If it's correct, make sure that you start to implement those quality issues within your QAPI program and work on those performance improvement projects from there. So again, review each one of your quality measures cut points. So again, I talked about antipsychotic for the first example. You can see in this CASPER report, this facility is flagging for their long stay antipsychotic medications at around 45.8%. And that puts them in the 98th percentile. We can see, 33 out of the 72 residents that would be part of this measure are triggering for this measure. And based on the cut points for this measure, you can see that this facility is only receiving 15 points for this specific measure itself. So when you're reviewing your quality measure rating and determining, how you got to your specific score, you can actually take a really deeper look into your CASPER reports and take a look at all the cut points for each of these measures to determine what your opportunities are to improve. So like I mentioned, in this case, the facility is really struggling with antipsychotic medications for their long stay residents and only receiving that 15 points out of the 150. And, you know, while it may be really difficult for them to get, you know, all the way to 150 total, they have a lot of potential points that they could get if they start making improvements in this specific measure. So some other measures that when you're reviewing, you may be only really a resident or two away that's triggering on a specific measure to help get you into that next threshold for points. And those are really the low-hanging fruit that you can work on to improve your score. And I actually have a future session about doing a deep walk through your data and strategies to go about doing that itself. But, you know, one of the things that I was going to highlight is, look, you have this facility who's triggering for long stay medications, for long stay antipsychotic medications, and that they're also triggering for behaviors as well. So, and then the loss of control for bowel and bladders. So a lot of these quality measures, believe it or not, actually have a domino effect upon each other, so that when you see an improvement in one measure, you actually see an improvement in some other ones. Melanie and Darlene, I don't know if you guys have anything you want to add.
You're doing a great job.
All right, perfect. So here's another example with your vaccine measures for your flu and pneumo. So while these measures themselves do not affect the star rating, they're still really important. And, you know, CMS has been honing in on flu vaccines, pneumo vaccines, and COVID vaccines. And these measures are actually really, really quite easy to score high in and to do well. Darlene, I don't know if you're, Dennis, actually, I don't know if you're on the line and want to talk about some of the things that the facilities can do for the flu and pneumo vaccine.
Sure, and we'll be covering it in some of the other sessions coming up. But if you notice that your short-term measures for flu and pneumococcal are lower than your long-stay measures, one thing to look at is that the short-term measure, well, both come directly from your MDS, and the short-term measures from your first MDS, the admission, that's done at like day 5 or 7. So that MDS coordinator is going to need documentation in the electronic medical record somewhere that the pneumococcal and influenza vaccines were discussed, assessed, administered, or if not administered, why they were not administered. And that has, you know, as I said, it has to be documented. Last week, we kind of touched on it, and I think Kayla had asked that they discuss it on admission, and there's a document that goes in the medical record. And I had said, that's great, but put a note in the electronic record so that the MDS coordinator can refer back to that note and be able to document that the discussion was had, so that you can count that in your short-term measure, if that makes sense.
Right. So the way these measures are actually calculated is that even if you are offering the vaccine and the resident is declining, as long as you're documenting everything and the MDS is coding it correctly, that's still positively affecting your measure that for the vaccines. So it's not a loss that they decline. It's all about the process for, you know, the flu and pneumo, and that you'll understand that when we're going to get into it in a future session as well, that a lot of these measures aren't necessarily always linked to outcomes, while a lot of them are, but some of them are all about your process or structure and how you're going about capturing the information. In these short stay residents, flu and pneumo, it can be really tough because their length of stay in their building is not long, and before you know it, they've come and gone, and you haven't assessed or offered them the vaccine, and you know you're failing your quality measure for that individual. So, you know, next, our very next session, session 5 next week, we're actually going to talk more about the flu and pneumo vaccines directly and what actually constitutes the measure themselves, who actually is included. And you're going to see that it can be, you know, these measures are really, really easy to get a really high score in if you have a good process in place and capturing all the information. So thanks, Dennis, for chiming in. I appreciate it. So we've gone through the health inspection rating already. We've gone through the staffing rating already, and we've gone through the quality measure rating now. So we now know how we can review how to calculate our overall nursing home rating. So again, we started with health inspection, and that's where it all starts. So your step 1 in calculating and understanding where you're at for your 5-star rating is to start with your health inspection rating. So whatever you got your health inspection rating, however many stars you got is where you start. Then after that, we can add a star to our overall rating if our staffing rating is 5 stars. And this is one of the recent changes that went into effect with the July 2022 refresh. Conversely, you would subtract a star if your staffing rating is 1 star. So before, you were able to add a star to your overall rating if your staffing rating was at least 4 or 5 stars and greater than your health inspection rating. But that has since changed so that you can only add a star to your overall rating if you have 5 stars in your staffing. There's a bigger emphasis on that staffing rating and staffing in general towards the 5-star. And then lastly, we can add a star to the step 2 result if the quality measure rating is 5 stars. And again, conversely, we would subtract 1 star if the quality measure rating is 1 star. So I actually have a little activity for you guys. Want to just test your knowledge based on these previous 3 sessions that we've gone through, the health inspection, the staffing, and the rating now. I want you guys to put in chat, what do you think this nursing home's overall rating would be? So they have a 3-star with health inspection, 1 star in staffing, and 3 stars in quality measures. What do you think it would be? Seeing a couple 1s, but seeing a lot of 2s. So actually, yep, it's 2 stars. So again, we start with our health inspection rating at 3. We take away a star actually from this total because their staffing rating is only a 1 star. And we can't add a star from their quality measure rating because it's only 3, and you need 5 stars in quality measures in order to add a star. So again, we have that 3 baseline, reduction of a star because their staffing is 1, and then nothing being added from quality measures to give us that 2-star rating. So
Josh,
one more.
we have a question in
Sure.
chat. Can they take away all your stars so you will have 0?
So you can only the least you can be is a 1 star. The lowest rating is 1 star that for your building. A lot of instances where facilities are having a lot of issues or not reporting their data, a lot of their data won't be available on the nursing home care compare website, but they'll automatically, a lot of instances like a facility will automatically be put down to 1 star. So no matter what you get for the total, it can't be less than 1. So thank you. That was a good question. So I have one more example for you guys just to test your knowledge and comprehension of this whole introduction of this series. We started with that 5-star component of the health inspection, the staffing, and the quality measures. What do you guys think this facility's overall rating would be?
The answers are coming in.
Yep,
This
perfect.
is great. I love that you're adding to chat.
Yes, thank you so much, everyone. And your comprehension of this material is meticulous. So again, we start with that 3-star total from that health inspection rating. That's our foundation again. And we know with the latest refresh that we can add a star if the staffing rating is 5. So in this case, they're 5, so we get to add a star. Unfortunately, we don't get to add an additional star because their quality measures aren't 5. So we add 0, and that leads us to our total for 4 stars. So you guys are totally getting it. You're totally understanding how the 5 stars calculated. And I'm really happy that we're seeing that in the audience. So wanted to touch upon the SNF QRP as well. So if you aren't familiar, the SNF quality reporting program, that's for the QRP, it was actually mandated into law back in 2014 under the IMPACT Act, which stands for Improving Medicare Post-Acute Care Transformation. And every year on October 1st, CMS publishes quality measures that skilled nursing facilities must report to. And a lot of these information is usually nothing that you guys have to do on top of what you guys are already doing, because, excuse me, all of you guys are submitting your MDS data because of needing to get paid. So you really, you should be doing that anyway. One of the recent things that was added for the a SNF QRP measure was actually your compliance in submitting your NHSN data and your vaccination data for your healthcare personnel. And then there's also Medicare fee-for-service claims data, which is data derived from measures that are collected from your claims, and no additional data is needed to be submitted from the SNF.
Josh,
Yep.
This is Darlene. The NHSN data is not how many staff, it's not on how many staff have been vaccinated. It's just whether they submitted the data or not, right?
Correct. So this is specifically quality reporting. So for this SNF quality reporting measure, they're determining your compliance with reporting the measure on a weekly basis that's required. So you should be doing that anyway, because it's a federal regulation that you should be going in and submitting your NHSN data. So you shouldn't have any problems, but if you are, then you're also, not only are you, probably getting citations and everything from CMS for failing to report, but it's also going to impact your quality reporting data as well. And this quality reporting program data is important because it actually helps determine rate adjustments for the building and for the fiscal year and everything. So there's a lot of information about what those quality reporting measures are if you're curious. And there's also an FAQ that I've linked as well if you wanted to take a look at that. And one last thing that I wanted to highlight is, as your quality improvement organization, because we are contracted directly by CMS, they provide us with claims-based data from all the facilities that are part of our collaborative. And we actually develop standard analytic reports to provide you with snapshot data on your quality measures. So we have, you can see here behind, there's some snapshot data for the quality measures and showing, whether low is better for the score, as high is better, and what the state average is for the state that you reside in, what your facility score is in as well. But we actually also provide and create historical data for your facility so that you can see how you're doing historically with each of these quality measures. So this is actually really particularly helpful because you can utilize this to help pinpoint specific interventions and performance improvement projects, and when you've implemented them, to see if you've made a positive improvement historically with that data. So I'm going to provide you guys with our contact information so that if you aren't already getting your facility level standard analytic report, I really encourage you guys to reach out to us so that we can help support you guys to get in and be able to access your own reports. They're really helpful. Again, everything that we do to support you guys is free, so might as well take advantage of it, right? And that's it. I'm going to leave our contact information up just for people can write it down. But do we have anything in chat?
Yes. So how we gain access to our reports? That's what people are asking.
Yep. So we use a website called Send, and it's you're able to log into facility level portal we'll help you get information so that you can log in, and you'll be able to log in and access your facility level reports. So if you aren't getting them already, again, reach out to us. Oh, oops, sorry, hit the mouse wheel. If you aren't already getting them, make sure you reach out to us so that we can ensure that you guys are able to get in and get these reports.
So the PowerPoint presentation earlier, I put into chat the link to the web page that the PowerPoint presentation will eventually be loaded to. We have to get it 508 compliant and what we need to do before it's put up there. So this whole series will be available at some point on that. Also, you can, I'm going to put in the
All right, perfect. So I see that Dennis had put in a link to the actual series page itself so that you can actually access and register for even upcoming sessions. But once we have these slides ready to be published, they should be able, you guys should be able to pull them from that slide as well. And Melanie, I think you included the sessions for this week.
Yes, I was sitting here talking and didn't realize I was on mute. I'm so sorry.
No worries.
So I went ahead and I added, so if somebody on your team wasn't able to join today and want to join tomorrow at 3:30, we are going to repeat this series. We did record it. We will be live as well to answer questions throughout the program. Also, IP3 this week at 11 o'clock. Please join us. For infection prevention by infection preventionists for infection preventionists, where we always have a great conversation happening there. It's open conversation. We decide on a topic, we talk a little bit about that topic, but it's really available for your IPs to have a question and answer session. So thank you so much for joining. We do try to keep this at 30 minutes. Josh, great presentation. If you have any questions, we'll keep it open. You can go ahead and add in chat or unmute your phones for about 5 minutes. Thank you.
Yep, and so next week, for those who are still holding on, Mary Ellen is going to be diving deeper into the actual flu and pneumo quality measures themselves. Again, as I mentioned earlier in this presentation, just to show you guys what actually goes into those measures and who actually trigger for these measures, and some strategies that you guys can implement to make a positive impact. We wanted to make sure we got that one out ahead of the gate because of the timeliness. And the session after that, we're going to be talking about doing that deep dive into your data, utilizing your CASPA reports, and using your data to drive your improvement. So we have a lot of great future sessions coming up. Make sure that you go to our series webpage and register for them. Again, if you had anyone that missed today's session, we have a recording of today for tomorrow at 3:30, and then IP3 at 11 o'clock.
CAUs are not included in this presentation, just to answer some of the questions. We have a web page that all of the slides will be linked to, and we'll continue to show you that web page each series program that we do, and but they're not quite ready because they have to go through the 508 compliance.
Yep, so I saw that there's a question in chat. What do you do when you click on the link to go to the slides? So when you click on the link to get to the series webpage, currently we only have the registration link for these sessions. But at a later date, we are going to go back and upload the presentations and recordings of these sessions, so that you can go back and review them and, get the appropriate material. As Melanie mentioned, we still have to make sure that we go through a 508 compliance to make sure everything's good to go before we can officially publish them. But that's why we're linking the series page every week. So in case anything's changed and has been uploaded, you guys will have the latest up-to-date information. And Maria had put in a comment, are these webinars NAB approved for LNHA-CEU credits? Unfortunately, these are not approved for CEU credits, but we do still hope that the information is useful for you and well worth your time. We do have, I'm sure we're going to have opportunities in the future where we would be able to provide CEUs for you guys. I know that's important. I myself am licensed administrator, so I know we need to make sure we get our CEUs when we can for our license. So I totally appreciate and respect that.
Well, thank you, Josh.
Yep, thanks everyone. I don't see anything else in chat, so we're going to end the session for today. And thanks everyone for participating. See you soon.